Welcome to the Center. I'd like to take a few minutes to help you understand what you'll encounter during your first visit with us. We hope this short presentation will further inform you of what we'll need before your first visit, what will happen during that first visit, and the expectations for your individual plan of care. In our experience, most patients prefer to get as much done as possible at that first visit. However, we recognize that some people are more comfortable just talking to us on their first visit. If you're coming in for a full evaluation, it will include taking your vital signs, a medical intake review, a physical exam, a vaginal ultrasound, and any relevant blood work. If your first visit with us is to just talk, this more detailed evaluation can be scheduled for a later date. You have 3 ways to make an appointment here at the center: a phone call directly to either of our locations, an inquiry from our website, or a fax referral sent directly from your OB/GYN. When you make an appointment, you'll have an intake conversation with one of our schedulers that will likely take about 15 minutes of your time. The questions you can anticipate include your name, address, date of birth, last 4 digits of your Social Security number, contact phone numbers, and your insurance information. We'll be registering your partner as well. There will be several medical history questions, such as previous infertility, that will help the scheduler complete the intake information. The center has a new patient packet which can be mailed directly to you, or you may download the packet from this website. This packet includes forms on your medical history, registration forms for partners, our financial agreement, permission to communicate, insurance information, including contact names, and a release of medical records form if needed. These paper requirements should be received back at the center 2 weeks prior to your scheduled appointment for review by the administrative and clinical staff. The center's financial service representatives will call your insurance company on your behalf to check your infertility benefits. We also encourage you to call them directly to confirm your benefit package and have a clear understanding of what is and is not covered. It's important that we have all pertinent medical records before we see you for the first time. We ask that you or your doctor please send us these records in advance so that we can review the material ahead of time, allowing for an efficient and productive first visit. This will be your responsibility to ensure the records have arrived at the center for review. The medical records that we'll need at our office include the following: your latest pap smear, cervical cultures if they've been obtained, and a physical exam performed within the last year. If this has not been updated, please make an appointment to have this done. We'll need from the OB/GYN a copy of your blood type and screen, any genetic screening, and any pregnancy loss evaluation testing. If you've had previous infertility evaluation and treatment, we'd also need the records from the infertility specialists that performed that workup. Before your first visit with us, we also ask that you please advise your primary care physician to send us your medical records if you have a medical condition or blood disorder. If your partner has had a urology evaluation, we will need that report sent to us as well. You will have to sign a medical record release form for this information so that it can be sent or faxed to us. The last important step to take before your first visit with us is to complete the new patient packet that was mailed to you, including the new patient intake record. All information, including the partner information, should be completed, and then the packet can either be sent to us or faxed prior to your first visit. Now it's time for your first visit and our first meeting with you. Upon checking in with the administrative staff, you'll be greeted by our medical assistant and escorted to an exam room. The medical assistant will check your height, weight, and blood pressure. If you should have a body mass index that's calculated to be greater than 40, a neck circumference will be measured. Please advise us at this time if you should have any allergies, especially to medications or latex. Again, we realize this can be a stressful visit and can do as little or as much as you are comfortable with at this time. You will then be greeted by a member of our medical team, either a fellow, a resident, or a clinical nurse, for the medical intake evaluation. This will take approximately 20 minutes and includes questions about your personal and family medical history. Following the medical intake, your doctor or the fellow will perform a vaginal exam and ultrasound. We realize that some patients are more comfortable just talking during this first visit. If that's the case, then these exams can be scheduled for a future date. If you're having a full evaluation, you'll be appropriately gowned for both exams. A vaginal exam will be performed using a vaginal speculum for cervical cultures and/or a pap smear. A vaginal ultrasound is then performed to assess and to measure the uterus and ovaries. You'll then complete your appointment with a consultation in your doctor's office, where your doctor will discuss your diagnosis and personal treatment plan. This treatment plan may require a procedure to be scheduled for a later time, such as a surgical hysteroscopy, laparoscopy, hysterosalpingogram, or sonohystogram. Your doctor will discuss any lab work that we may need, including day 3 labs, infectious disease labs, blood type, thyroid, and prolactin testing. This may also include genetic testing or pregnancy loss evaluation testing. If necessary, your doctor will discuss a comprehensive semen evaluation or urology consult for your male partner. At the completion of your visit, your doctor will discuss your follow-up care and when you should return to the center. You'll then meet with our financial representative, who will spend time with you to explain your insurance benefits for infertility specific to your treatment plan. This completes our explanation about your first visit with us. We thank you for taking the time to view our video, and we hope this has helped you better understand and prepare for your new path through infertility. Please explore more of our website or call us with any questions or to schedule your first visit.